वीकेंड संचारबंदीचा निर्णय देते आहेत. शनिवारी रात्री 8 वाजतापासून मी सर्व लोकांना आवाहन करतो आहे की त्रिसूत्री नियमाचे कड़काईने पालन करावं.
मुंबई का जो हमारे नागरिक है वो लॉकडाउन के पास जाने को देखेंगे ही नहीं, खुद को संभालेंगे. तो मुझे लगता है हम सब कार्य ये दायरे में रह के SOP के दायरे में रह के काम कर सकते हैं.
Hello everyone, you're watching News Epicentre with me, Marya Shakil. India is unlocking even as the vaccination drive continues across the country, but flattening the curve remains a struggle in 2 states. Maharashtra and Kerala have seen a surge in COVID cases, with the Maharashtra government introducing relocks in multiple hotspots and boosting the enforcement of COVID rules in the maximum city. Even as over 1 crore people have been vaccinated, doubts persist over the vaccine, causing roadblocks in the rollout and in many cases states failing to hit the projected mark. By February 15th, only 26% of the healthcare workers took the second dose. People have fear of an adverse reaction, doubts over vaccine efficiency persists, there is confusion over the duration of immunity and fear of long-term implications. This comes even as the nation's top doctors have taken the jab and have appealed to all frontline workers to lead the fight against the virus by taking the vaccine. But India continues to be behind the United States and United Kingdom when it comes to the vaccine rollout. And what is complicating the situation is that COVID fatigue seems to be getting the better of us, with open flouting of COVID regulations, be it social distancing and wearing masks. So we are not out of the woods yet. The virus is still a clear and present danger, and more contagious variant from United Kingdom, South Africa and Brazil are already in India. The need of the hour is to keep our guard up, and the big question remains, what more can the government and the medical community do to ensure that citizens are ever vigilant and have faith in the vaccination drive? Joining me on the show, Dr. Anupam Sibal. He is the Group Medical Director, Apollo Hospitals. Dr. Rahul Pandit. He is the member, Maharashtra COVID Task Force. Dr. Raman Gangakhetkar is an epidemiologist. Dr. Ashok Seth, Chairman, Fortis Scots Institute. I'm going to begin with you, Dr. Gangakhetkar. I'm looking at certain details here. Would you say that this is a temporary reversal? And given that over 1 crore Indians have been vaccinated and second dosage has begun as well, the chain will be broken soon and things will be normal.
I think it all depends on us whether we want to call it as temporary reversal. No, we know we are in the decline of the first wave itself. Now we also know that COVID fatigue has started setting in. Now everything is in our hands. No, if we try to ensure that COVID appropriate behaviors are followed, perhaps we will not end up into a situation where second wave will start. The variants that are likely to emerge can bother us a lot. As of today, the number of variants continues to be small. We also know since they are small, we can go for good contact tracing. We can isolate all these people. So far, these variants that have been detected are from international travelers. So essentially, what does it essentially mean? It means that everything is in our hand.
Okay.
We need to convince people, we need to motivate them, mobilize them, and try to make them understand that the need of the hour is maintaining a strong vigil and ensuring that we adapt all these behaviors, COVID appropriate behaviors, regularly and stringently whenever we go out.
Dr. Gangakhetkar, I'm looking at certain statistics. 16 states and union territories have reported 0 deaths. But the surge that is happening largely in Maharashtra and Kerala. Why is it so?
No, one thing which we have to realize is some of the issues always depend on the factors that foster or favor the exposures itself. One of them is population density, second is mobility. Maharashtra continues to have a very high population density and also the mobility. What is more worrisome in Maharashtra is its resurgence, probable resurgence in Vidarbha zone, where population density may not be high. Perhaps it's a reflection of the lifting of lockdown, especially with respect to the students, whether they are going to the schools or colleges, that may be making a major impact. As far as Bombay is concerned, we have both the opening of schools and colleges as well as the people being allowed to go by a local. When it comes to Kerala, the situation is entirely different. To Kerala, as to my mind, the first wave itself has not declined, and that is mainly
Okay.
because their population density continues to be high. It's a small size of the population. Despite that, you will find that majority of these villages are located one after another across these highways, and there were episodes of Onam, which also led to reduction in following of this COVID appropriate behavior.
Okay.
So both the places things are almost similar. When it comes to maintenance or resurgence as such, we also need to remember this is a marriage season. The
Yes.
best thing that all of us have to remember is we need to follow the guidelines that the government has issued if we are to even go for an event like marriage, and ensure that the number of people who come there are small, and then essentially we follow the COVID
Yes,
appropriate
I'm going to
behavior.
take the case of Maharashtra a little more with Dr. Pandit, because he is the member of Maharashtra COVID Task Force. Dr. Pandit, there is a marked change in the coronavirus trajectory in the last 2 weeks in the state. The numbers have slid back to where they were more than a month ago. One assessment is that it could be because of Gram Panchayat elections. Or will you say that there is also a degree of disbelief among the people that that coronavirus days are over?
I think there have been multiple factors, but the fact remains that we've actually gone backwards, and perhaps we have to start from the basic measures which we did in the last year, March and April. And that would be again, you've got to go and follow the basic measures of contact tracing, testing, and isolating these patients. Behind every one patient, we need to trace at least 18 to 20 contacts and isolate the suspects which are there before actually we have this spreading up a bit more. About the Gram Panchayat elections, whether it is a Gram Panchayat elections or it is a local train starting up or the schools and colleges starting, I think it's a multifactorial thing. But there is certainly one thing which is seen, that across the country, there has been a decline in the COVID appropriate behavior. And there seems to be certain bravado that the COVID is not in the air, which we all actually keep on talking that COVID is very much there. It has not gone anywhere. So I think that pseudo sense of security needs to be basically again educated. Mass communication needs to be done to the people, that it is sort of something which we need to be following up. Even today, the Maharashtra Chief Minister sort of compared the mask to the shield which Shivaji
Yes.
Maharaj had during the fight, and he said that it's the shield which is going to protect you right now. And I think the mask is the single most important vaccine which we have right now.
Okay.
We all may talk about vaccination programs being improved, but the mask is still remaining the single most important thing.
Dr. Seth, let's talk about the vaccination drive a little more, because today is the day that India has crossed that milestone of 1 crore vaccinations. What's the number at which herd immunity will be reached? Do we have that estimate?
Marya, I just wanted to state that while the COVID inappropriate behavior has to be emphasized again and again, and masking is absolute must for a long period of time, let me just say that the whole of India is in the shackles of a COVID inappropriate behavior. So there is a concern that we're seeing the numbers in Maharashtra and Kerala rise. And by the way, we are always looking for explanations, but let me just state that we're trying to find explanations, but we don't have the explanation totally. The variants will come in. We know that we don't know enough about the virus, and the COVID inappropriate behavior, however emphasized, needs to be so emphasized, but will not be followed by everyone. So what is going to be the next step? The next step is always going to be, it's great to have, like you said, 1 crore vaccinated. We crossed that number.
Yes.
It's the fourth largest number in the world.
Yes.
But we also have to see that when we talk about vaccinating nearly 75% of the population, we're far behind. And it's only this COVID appropriate behavior along with more augmented vaccination drive which will take this thing under control. Think of the fact that we thought that we would actually have 30 crores vaccinated by July. That includes healthcare workers, that includes the frontline workers, and that includes all the people who are susceptible to COVID, increased susceptibility to COVID. We're perhaps at 4% in 1 month.
And why do you think that is the
nearly 1.5 to 2.5
what
years
exactly is the reason behind this? Is this
very important.
availability
This drive
and also
needs to be
accessibility of the
augmented,
vaccines?
enhanced, and we need to look at ways to do it.
So then in that case, are you saying that the private hospitals have to be roped in for the immunization drive?
I'm saying definitely that we should look at multiple methodologies. You know, the herd immunity you just said, that happens approximately, and nobody knows exactly, but when 70% of the population has had either got an infection and therefore are immune to it, or have artificial antibodies created by immunization. Now, those are the numbers that we've got to achieve to have herd immunity. Let's assume that there are 10 to 15% there already who've had silent infections. Still, across the country, we're still running at 20 to 25% antibodies on a sero survey. We have a long way to go. And if we've got a long way to go, our drive at the moment is never going to achieve herd immunity over the next 2 to 3 years. So yes, we got to look at whether private companies come in, whether private systems come in. While you talk about hesitancy, vaccine hesitancy, I get 25 calls a day from numerous patients saying, how do I get myself vaccinated? When is my number going to come? When am I going to get vaccinated? I don't think we should be sitting on an edge telling them that is going to be perhaps next year. There is no reason for a susceptible patient or a population to have the vaccination earlier through any systems that we can create, which after all, we get vaccinated every year with some vaccine or the other for virus, for viral infections, and there's no reason for us to actually start thinking, how can we broaden the vaccination drive rather than keep it in silos?
Okay, so then in that case, Dr. Sibul, what should be done? Should it be about ensuring that the population at large gets accessibility to the vaccines in that case? If we have to speed up the vaccination process, although with 1 crore, India is among the 4 top countries to have got that many people vaccinated.
Thank you, Myra. So let's look at some data points. India has a population of 135 crores. The first phase that the government has planned is 30 crores. Now, 30 crores, when you look at 135 crores, you say it's only 30 crores, but 30 crores is just 3 crores less than the population of the United States and 3 crores more than the population of the 4th most populated country in the world, Indonesia. So I think the ambition, the goal here is lofty. And when we look back at at a crore doses that have been administered, when you start a program, there are so many little challenges that you have to overcome. You have to make sure that the vaccine reaches, thousands of centers every day at the right time. People come in at the right time. People don't show up exactly at the time they're supposed to be coming. That results in delays and so on and so forth. So I think there will always be teething problems. And I think we are past the teething problems now. It has been demonstrated that we can effectively, on a very large scale, administer the vaccine. Now what we need is scale up, and that's exactly what the government is planning, moving on to frontline. And then the fact that the government has chosen individuals less than 50 who have a comorbidity, I think is very welcome, because we know that the two groups that are hit hard are those older than 50 and those less than 50 if they have a comorbidity. So I think we have a great plan. What, of course, is needed is scaling up. We fortunately have the ability to make the vaccines. After all, 70% of the vaccines for COVID in the world are actually going to be made in India. It's a question of enhancing the coverage. It's also about people being a little more serious about being on time, following all the guidelines that we have about vaccination. And of course, the government has said that it's going to be about a public-private partnership. So let's look for a minute. of the 200 million tests that have been done, while there are 1,200 plus public sector labs, there are also 1,155 private sector labs. When it came to treating patients, while we look at ICU beds, there are 35,000 in the public sector, there are 59,000 in the private sector. And for the ventilators, 17.8 thousand in the public sector and 29.6 in the private sector. So the war against COVID has been a remarkable collaboration between the public and the private sector. And it's only a matter of time when the government will ask the private sector to support. And as it is, as you know, even today, the vaccination is done in private and public sectors, with the public sector, which means the government
Yes.
machinery, administering the vaccines in the premises
So-
of the private sector. So we're going to see a scale up.
Okay.
And I think we need to be positive. But one or two important points, and Mara, you said that in your opening comments, that these concerns about how long will the immunity last. Well, we
Yes.
don't know how long the natural immunity lasts after you get the SARS-CoV-2 virus infection. So we don't have the answer. But that does not mean that because we don't have all the answers, we have a degree of skepticism. These questions about fertility, questions about the side effects. There are just too many of these questions that every day we keep answering. I think we need, as a group, and that means the media, the medical community, the government, everybody needs to give out positive messaging about vaccination.
Yes.
But one thing that we have to realize, and all of us need to realize, that it's going to take a while for us to vaccinate everyone who needs the vaccine.
So,
And
but
for
then
that time,
target
we
of
have to
30
follow
crore
the
Indians, although you put it in context rightly with the population of other countries as well, Dr. Sibal, then what do you do? How do you scale up? Or will you say that degree of caution that has been, carried out by the government of India with 1 crore reaching today was the right strategy, because people had to be taught that you were fine, there have been no adverse effects, everything that is being reported from various public health centers are in the right direction, and that was it part of a larger strategy that this is the way it will be slow and steady?
Absolutely, it has to be, Mara. Can you just imagine if there were some problems? I mean, the whole process could have been derailed. The negativity, I already mentioned the degree of skepticism. You alluded to it. So if there were any glitches, then they would have been amplified. So now we've demonstrated 1 crore is a decent size. We have the ability to scale up. We will scale up. But while we are scaling up, we have to remember that the 3 T's are going to be very relevant, which is track, test, and treat. And of course, SMS that all of us are familiar with. Masking is not happening as much as it should. Weddings are taking place, parties are taking place. And, one has to ask oneself this question, do I really need to be there? And if I'm there, why is my mask coming off? Social distancing, and of course, hand washing. So this is going to be a battle that's going to wage for a while. If we feel that life's going to come back to normal in the next 3 months or 6 months, not happening.
Yes, and it's not over in a epidemic of this nature. We really do not know till when it will be, and it's not over till it's over. And so I'm just trying to understand. Let's start wrapping the debate, and I'm going to begin with you, Dr. Ganga Khedkar. Is it because the trend largely so far has been that India has been almost immune to the trend seen worldwide because of the manner in which COVID management has been carried out, and that is the reason why we are discussing perils of complacency, perhaps?
No, that is a possibility that you can't rule out, because it all depends on the perception of risk to acquire COVID-19 that the people will feel whether I should take vaccine or not. But at the same time, one must remember that even for vaccine, you look at the paradox. When the side effects tend to be so rare, but still majority of the population is also ending up into vaccine hesitancy. But when it comes to the real issue related to no adherence to the COVID appropriate behavior, we know for sure you are predisposing yourself to acquire this particular infection, but we don't recognize it as a major threat. I think what is happening is people are moving out. People are moving out for variety of reasons, and they are not following this COVID appropriate behavior because of the low risk of low perception of the risk that the cases are not increasing. But one must always remember that when the second wave strikes, it has always led to a very rapid rise in number of cases. And at the same time, what we have observed in the West, that even hospital beds become very difficult to be available for patients to be admitted. We need to try to do something and try to convince people. I think there are two things which are extremely important.
Okay.
One, as people have been saying, public private partnership as an issue which has been very well talked about. But the second issue that is most important is mobilizing the community. We need to ensure that community is mobilized by those people who can influence, whether it is within their households, whether it
Yes,
is
the
in the
community leaders.
community, whether it is in their groups in which they tend to mix up, their social networks tend to be existent, and this influence circle of influence in that particular social network continues to be high for those people. What is also important, government may have to come up with group specific communication strategy. Now, you cannot have one communication strategy that talks of adherence to COVID appropriate behavior, because that strategy doesn't work so well with, let's say, adolescents. Now, adolescents may not follow it. So, what we need to do is essentially you have to have targeted approach for information and education campaigns that you need to have,
Okay.
mobilize community, ensure that key opinion leaders at every level. Only one key opinion leader across the state or a country or a city will never work.
Okay.
You need to have everybody involved.
Okay, involve everybody is a message coming from Dr. Raman Ganga Khetkar. Dr. Seth, your thoughts. Will you say that there is vaccine hesitancy, or is it about accessibility?
It's actually at the moment both. And we therefore have to understand that we've done well in the first month, but the teething problems have to be sorted out. And again, a sit through to enhance and augment this drive. Like I said, for every few people who have the vaccine hesitancy, there's perhaps a double out there who really want it done. And gradually, the vaccine hesitancy gradually goes away. So the fence sitters will come back. We must remember that at the end, we've got four. We've got to have a multi-pronged approach to this. The test, look out for it, isolate, treat, we've talked about, but we have to look for variants as well. We've got to be very cautious about the variants. We've seen in the West, and that's going to be one of our concerns as we go forwards. While we keep emphasizing the COVID appropriate behavior, we must also realize that there's a huge socioeconomic barriers which does not allow COVID appropriate behavior, however you may actually want to preach and pray. And therefore, we want to come back to the fact that the four-pronged approach has to include an augmented vaccination drive. Otherwise, we'll be behind this virus all the time. It's very, we always want to be ahead of it rather than behind it. And that's what's concerning me at the moment.
Okay. Final words to you, Dr. Sibul. 30 seconds is all I have for you.
Well, I think it starts with me. Each one of us needs to be responsible. Our behavior has to be appropriate. We have to think not just for ourselves. We have to think about our families. We have to think about our friends, our colleagues, and our community. And if we start thinking about, is my behavior appropriate, we will see a change.
So how much of a threat is it, the UK variant, the South African and the Brazilian variant?
Okay, let's I mean, you have only a few seconds left, Myra. So basically, there are always going to be variants. There are already 13,000 mutations. That doesn't worry us because mutations are common in viruses. What we have to see is what kind of a variant is it? Is it going to have an impact on either how it spreads in terms of greater degree of spread, or it causes more serious disease, or does it have a mutation which compromises the efficacy of the vaccine? So it's going to vary. We are going to continue to see variants. That is fine. We also have the ability, should there be a need, to rejig our vaccine, which we will be able to do. Let's also not ignore the fact that every year the WHO releases what type of influenza viruses do we have to attack every year. So I think we have a lot of tools, but it's about behavior. It's about behavioral change, which is always hard. Fatigue has set in. It's coming to 11 months now. People are fed up. And we have to have positive messaging that you've done well for 11 months. We've done as a nation extremely well. We need to continue on this trajectory and fight this and win this battle.
Thank you so much for joining us, Dr. Sibul, Dr. Ganga Khetkar, Dr. Seth and Dr. Pandit. Of course, this is one discussion that will continue to happen with certain partial lockdown happening in Maharashtra, certain districts, and also in Kerala. That's all from me. Thanks so much for watching.